Hello everyone, and welcome back to the channel. This is Dr. J. I appreciate you coming back to the channel. If this is your first time, thank you very much for stopping by. We have 3 patients for you today. This first patient here is just a one-sided ear case. You can see there, as soon as you look in the canal, that the wax impaction is concave. This is a result of hearing aids causing this concavity. It's a very common problem for those who do wear hearing aids. It's not every case, and every patient that wears hearing aids will have this problem. It can be just a unique set of circumstances for that patient, and sometimes it winds up creating this obstruction. And what happens when you have this concavity that builds up right at the tip of the hearing aid, the little microphone that's in the tip of the hearing aid is no longer able to transmit the sounds past that to the eardrum, rendering the hearing aid not as effective. And so it's important that these people, if we can't get them on a regimen or topical drops or a type of hearing aid that will work well for them, then occasionally they will need periodic debridements. And how often they need to come in is very variable. For the more severe cases, I usually recommend every 3 months. If it's less severe, 6 months or 12 months. And in some patients, it's just, hey, you know what, just come in when you recognize that there's a problem, and we'll just treat it on an as-needed basis, and that's fine. This little last remnant here is a little bit of old wax, but you can see it's very densely attached to some old skin in the ear canal. Just using the alligator forceps here to just gently lift that up. You'll see here as well that the old skin in the canal that wasn't able to move out as a result of the wax impaction in the hearing aid has become quite hard and almost rigid and crystallized. This is what old skin will do if it's kind of up and exposed and away from the ear canal. It can become quite rigid. There we pulled away the last loose segment. Looking at the eardrum, there's a little scarring on the eardrum on that bottom part. But otherwise, the canal's nice and open. They'll be able to use their hearing aids just fine now. This next patient is what I would consider a routine ear cleaning. I have a patient that comes in with some ear complaints, or maybe I just happen to see the ears during my routine head and neck examination, and then offer them a cleaning at the time or have them come back for a cleaning. This first side, the right ear, it has the consistency of what I like to call old, dry honey. We've all seen that honey that's just really old sitting on the shelf. Maybe it's microwaved a few times and it's kind of hard and crystallized, and unless you warm it up in some warm water, hot water, or in the microwave, it's just not going to be able to come out of the honey jar very easily, especially if you're using a squeeze bottle. But what we have here is some golden, kind of brownish cerumen that's relatively soft, and then you have some densely attached squamous epithelium or old skin. And once that piece is out, you can see the rest of the canal is wide open, a healthy-looking eardrum, no evidence of middle ear disease. Moving on to the left side, we have very similar finding. It's kind of deep and in the canal. Looking at this, if I was to look at it the first time and not interviewing the patient, I would say this has been pushed from the outer part of the canal to the inner part of the canal, either by Q-tipping or I know this is a little too deep for hearing aid use, but it's certainly possible. I would say this is more of a result of Q-tipping, and you can tell that the wax and old skin have been kind of folded back on itself there deep in the canal. This was just resting in front of the eardrum here. Gently moving it out, and again, alligator forceps come in, and we're able to get the bigger piece out, but as we go back in, there's still a little bit of work that needs to be done. These little loose, flaky pieces come out fairly easily. Sometimes alligators are just not the right tool to use. My go-to, if suction can't do it and alligators can't do it, is my right-angled hook. And we'll pull that out here in just a moment. The suction just can't get a good grip on it because it's too rigid. It's not soft enough, and so it won't get a good seal at the tip of the suction. And sorry for my thumb there. So we use the right angle again and just get behind it, roll it forward, and then once we're able to do that, then it's able to move out much more easily. There we go. Now, the backside of the ear canal has is a very similar finding. It's just a little pile up on the what we call the posterior canal wall. Here, just using the suction just to tease it up off of the ear canal wall. Being very careful not to rub the canal wall itself, and just try and keep the tip of the suction on the loose skin and loose wax that's back there. Not coming out on its own, so alligator forceps again to the rescue. And right there, you can see I probably pulled on a little bit of her ear hair there. That's a pretty common thing, especially when you have that loose skin there in the front. And a healthy looking eardrum there. The last patient here has a lot of old loose squamous debris with some cerumen impaction. This is kind of similar to routine ear cleaning. It has a little more squamous debris than what my usual routine findings are. This was an older patient, and she was just not able to hear very well. I don't believe she had the opportunity to have hearing aids yet, but once this was all cleaned up, and we could see that it was just a cerumen impaction and loose skin problem, then we were able to get her set up for what we call a formal diagnostic hearing evaluation. And what that means is that she gets a hearing test. And with the hearing test, we're able to determine if this is a nerve problem or a sensory neural hearing loss, or whether it is a conductive hearing loss or a combination of the two. In that scenario, we call it a mixed hearing loss. With that information, we can say, probably hearing aids are your best option, or you know what, hey, there's an issue here that we're going to have to look at. We may need to get a CAT scan or an MRI, depending on the results of the hearing test. It's a pretty common statement that people say, well, I don't need a hearing test just for the test to tell me that I have hearing loss. And people just don't understand all the time that a formal diagnostic hearing test is not just can you hear or can you not hear. There's many different elements that can be tested during a routine audiometric evaluation. Again, we talked about the nerve conduction versus the air conduction components. If there's significant asymmetry, we want to make sure you don't have something called a acoustic neuroma, or vestibular schwannoma is a more proper term for it. And that grows on the nerve that goes from the inner ear to the brainstem. There could be evidence of cholesteatoma formations. If the hearing loss is fluctuating and it has the right pattern, maybe it's a Meniere's disease and has to do with salt intake in the body. There is otosclerosis, a lot of different things that we could find on that. But anyways, thanks for sticking around, watch to the end. Appreciate all those who return to the channel. Thank you very much, and have a great day. We'll see you on the next video.